Welcome to the Logan Hospital. This is where your journey begins with day of admission to these surgical admissions. Let's take you through. Morning of surgery, you'll be greeted by one of our friendly administration officers. They'll go through some information with you, some contact details, verify all your personal information to ensure your safety. Next, you come into the admission area. One of the admission nurses will collect information from you. They'll verify your procedure, check your allergies, check all your details to ensure that we have everything right for your operation. We'll go through a whole bunch of questions with you. Many people will go through those same questions, and that is very normal. Again, just trying to make sure that you have a very safe journey.
Hi, I'm Omar. I'm one of the anesthetic nurses and I'll be looking after you today. This is the induction bay. In here, we do a couple of things. One is we have a chat with you, make sure we're doing the right procedure, the right case, the right side, depending on what it is. And from there, we move on to finding out a nice spot to put that nice cannula in, whether it's in your hand or in your elbow. Okay, and this is when we hook up the bag of fluids. Going from there, we prepare you for going inside. So after attaching the fluids, everybody comes in, we have a chat, making sure we get your details like your name, date of birth, and the procedure. This is one of our theatres, and over here we've got the table, and this is where you'll lie down, and we'll start connecting up our monitoring, such as blood pressure, ECG, and SAS Pro, and that's just to monitor your oxygen levels while you're awake and when you're asleep. As you look around, it's quite big, and we do a couple things. Besides the observation, we get ready for assisting an anaesthetist, and that is by, sometimes depending on what it is, we might put a tube down. This is one of the instruments we use, it's called a laryngoscope. ETT tube, which is endotracheal tubes. In some occasions we might have to put this airway in, other occasions what we have is called an LMA. And if the spinal is working very effectively, you might not require any type of airway intervention, it might just be a Hudson mask. So all the best with your surgery from the Logan Peri-operative team and team anesthesia, okay?
Hi, my name is Matthew. I'm one of the anesthetists at Logan Hospital. My job involves looking after patients mainly through when they come for their surgery, both before your surgery, during and after your surgery. And I also look after little kids, older patients, but also moms that are having a baby. And it's an excellent opportunity to just be there to help people during this really sometimes challenging time. And what I do most of the time is looking after them whilst they come in before they go to sleep, and it's an important time just to reassure them that they're going to be safe, take away some of the anxiety that they come in with, and explain to them what is going to be happening, and that really helps patients to just relax. But also we use most of these gadgets here that you've seen, medications to safely put patients to sleep. In Australia, anesthesia is really, really safe, and that's just reassure patients when they come through, and I will stay with them or my registrar all throughout the surgery, and when they are awake, we'll take them safely to the recovery room, and there I've got we've got a team that also continue to look after them. But not just during that time, we also look after our patients. Even after they leave this theatre complex, we catch up with them on the ward and do some pain clinics, just to make sure they're coping after your surgery in terms of pain management. But if any additional help is needed, our surgical colleagues or the nursing team on the ward can always give us a call to help out as required. Safety-wise, we work as a team, even though you may see us come as an anesthetist, but we're part of a big peri-operative team, ourselves, the surgeons and nurses. And I actually have a colleague who is the anesthetics nurse or the anesthetics assistant that works alongside me to make sure you're going to be really, really safe during the procedure. And these things are very helpful, working together to make your journey all through this period a really safe and swift.
My name's Alex. I'm one of the operating theatre assistants or wardies at Logan Hospital Operating Theatres. Our role entails setting up each morning the 8 to 9 theatres worth of different cases. After that, when the cases start, we are also involved in transferring the patients from surgical admissions unit through to the operating theatre anaesthetic rooms. We are then called upon to bring them from the anaesthetic bays through to the theatres and assist the patients in their transfer onto the table. We like to stay in the theatres for the patient's induction to help keep them safe so they don't move around too much on the table when they're heading off to sleep. After the patient is off to sleep and it's appropriate, we then assist the surgical team in positioning them as per the case's requirements, whether that be lithotomy or prone or whatever it be. Afterwards, we are also available to retrieve equipment for the theatres, depending on different requests that might come around. We then come in after the case is finished and we assist in positioning the patient or holding them in position whilst they apply any splits or casts or anything like that. Afterwards, we will be involved in transferring them through the recovery area when they wake up, to which we then head back to the theatres themselves, clean them up and set it up for the next cases, and then we'll repeat that 10 to 15 times a day.
Hi, I'm Hayley. I'm a scrub nurse at Queensland Health. My role as a scrub nurse is to make sure patient safety is maintained. I do this by managing sterility. That means keeping things clean. That means we have sterile packs with gowns and gloves and drapes, and that helps you keep safe. I also apply some antiseptic to your body wherever you're having an operation. I make sure that we have the right patient and the right procedure that you're having done, and I do this by checking your consent. At times when you come in here, there are a lot of people in the room, and that's fine, it can be quite overwhelming. But the nursing staff are more than happy to help you. Other roles that I have is counting items like Raytex and sponges, and making sure I have all equipment that I need to help the doctors and maintain the procedure safely. I have another friend who I work with, and they're called a scout nurse.
Hi, I'm Jamie Harvey. I'm one of the surgical registrars here at Logan Hospital. I've just been asked to talk to you about the role of the surgeon, and some people mistakenly think that it's just about operating and cutting, but it's more than that. It's being professional, it's being part of the team, it's about communication with everybody around you, and working like a Formula One pit crew in a way. More importantly is the relationship with the patient and fighting for them to get the best treatment option. And again, it's not about surgery all the time. Sometimes you talk about the non-operative options. And then with surgery, you explain the risks, benefits of doing nothing and doing something. And basically translating all the complex anatomy and complex medical jargon to the patient so that they make an informed decision going forward.
Hey, welcome. My name's Mel. This is the recovery room. This is where you wake up. This is where we get on top of your pain and nausea and get that at a bearable level. We also check your surgical site and do a skin assessment. So we're checking for any pressure areas or injuries from theatre. We also get your parents in if you're a child once you're awake and stable. Depending on what type of anaesthetic you've had will depend on the time that you stay in recovery. So provided that that's all okay. So for a sedation anaesthetic, you'll only need to be here for 20 minutes. And for a general anaesthetic where you fully go to sleep, it's a minimum of 30 minutes, provided that your pain and nausea and all your vitals are all good. We also do day surgery, so that is where you will go after as well. It's also known as second stage, where we get you dressed, have something to eat, and then send you home.